Thank you so much for joining us today. In September of this year, 230 major medical journals, including the New England Journal of Medicine, the Lancet, the British Medical Journal, released the same editorial on the same day, calling climate change the greatest threat to human health in the 21st century, and urging our decision makers to act boldly and swiftly to protect human health. In California, we are on the front lines of this crisis. Worsening drought, heat, and wildfires are already affecting our health. In the last 3 or 4 years, we've seen wildfires of scale and severity that stand to grow worse with continued warming. California's wildfires have resulted in scores of immediate deaths from those unable to evacuate, hundreds of thousands of Californians displaced from their homes in the aftermath, millions more affected by the poor air quality that now lasts weeks to months. As a pediatrician, I see this play out in the hospital with more kids coming in with asthma and more expectant mothers coming in preterm labor. We understand that the effects of wildfire smoke are not borne equally, with communities of color, communities experiencing poverty, infant, women, and the elderly more vulnerable to its damaging effects. It has never been more critically important to understand the health risks due to climate change in our worsening wildfire seasons and implement solutions. We're so excited today to be joined by 4 experts who will talk about the intersection between health, equity, and advocacy to discuss concrete solutions to this evolving crisis. Our event today is being hosted by Stanford Woods Institute and Alpha. The Stanford Woods Institute for the Environment is working towards a future in which societies meet people's needs for water, food, health, and other vital services while sustaining the planet. As the university's hub of interdisciplinary environment and sustainability research, the Stanford Woods Institute is the go-to place for Stanford faculty, researchers, and students to collaborate on environmental research. Their interdisciplinary work crosses sectors and disciplines, advancing solutions to the most critical, complex environmental and sustainability challenges. Alpha is the Action Lab for Human and Planetary Health through the Stanford Center for Innovation and Global Health. This is an evidence to action initiative that stimulates change in an emerging field central to sustainability, human and planetary health. Alpha supports Stanford researchers who are translating their findings to impact through changes in policy and practice. I'd encourage all of our participants to use the Q&A feature located in the menu bar, either at the top or bottom of your Zoom screen, and we'll try to get through as many questions as possible with the aim of wrapping up by 1 p.m. I now have the honor of introducing our 4 amazing panelists. First, I'd like to introduce Marshall Burke. He's an associate professor in the Department of Earth Systems Science, deputy director at the Center for Food Security and the Environment, and center fellow at the Freedman Spogli Institute for International Studies at Stanford University. He's also a faculty research fellow at the National Bureau of Economic Research and a co-founder of Atlas AI, a remote sensing startup. His research focuses on social and economic impacts of environmental change and on measuring and understanding economic development in emerging markets. He holds a PhD in agricultural and resource economics from the University of California, Berkeley, and a BA in international relations from Stanford University. Next, we have Dr. Mary Pernicki. She is the Director of Air Pollution and Health Research at the Shannon Parker Center for Allergy and Asthma Research. Her research investigates the impact of air pollution, including wildfires, on the immune system. Mary received her PhD from Northwestern University and her MD from Southern Illinois University. We next have Michael Wara, who's the Director of the Climate and Energy Policy Program at the Stanford Woods Institute, where he provides fact-based, bipartisan, technical, and legal assistance to policymakers engaged in the development of novel climate energy law and regulation. He also facilitates the connection of Stanford faculty with cutting-edge policy debates on climate and energy, leveraging Stanford's energy and climate expertise to craft real-world solutions to these challenges. Wara's legal and policy scholarship focuses on carbon pricing, energy innovation, and regulated industries. He collaborates with economists, engineers, and scientists in research on the design and evaluation of technical and regulatory solutions to climate and energy challenges. He's also an expert on international environmental law, with a particular focus on ozone and climate treaty regimes. He received his JD from Stanford Law School and his PhD in ocean sciences from the University of California at Santa Cruz. And finally, we have Ami Rabal. She's the Policy and Research Director at the Asian Pacific Environmental Network. Ami offers an environmental justice and health equity lens to climate and energy policy in California. She previously worked with the Natural Resources Defense Council on research and advocacy, addressing the environmental and occupational health impacts of extreme heat due to climate change. Ami graduated with an MS in environmental health sciences from UC Berkeley School of Public Health. All right, let's get started. So this first question is going to go to all of our panelists, and Mary, we'll start first with you. We're hopefully nearing the end of another terrible wildfire season here in California, driven by climate change. And what my question to the panelists first is, what impacts have you seen of our worsening wildfire season on your work? whether it's the populations or patients you work with, or the research questions you're asking, given the severity and scope of the problem?
Thank you, Lisa. Our research centers around several vulnerable populations, children. Also, we're looking at the health impacts on firefighters with long-term and acute exposure. And what we're finding is echoed in studies that are coming out as recent as last month, showing that globally, wildfires are causing increased mortality. A study last month showed that globally in 43 countries, 750 cities, wildfires have a short-term impact will increase mortality. And the greatest impact of the smoke exposure is on the initial day of exposure, day 0, but there are impacts, especially in the first 3 days of being exposed to the smoke. Other research has shown recently that the PM2.5 in wildfire smoke is more toxic, causing more health problems, increases in respiratory hospital admissions in comparison to PM2.5 from non-wildfire sources. So our research is showing on a cellular level, looking at the immune system, seeing that even an acute exposure is causing changes in blood biomarkers and inflammatory markers, and it kind of confirming what we're seeing in the epidemiological sector of wildfire research.
So that's really concerning because we're actually seeing even longer wildfire seasons, but even that acute exposure can be dangerous. Michael, I'll ask the same question to you.
Well, our work with policymakers continued this year, and we, what I would note about it is that after another really extraordinary wildfire season with smoke impacts to tens of millions of Californians, I think the willingness of policymakers to think big about this problem is really increasing with time. And so we need to make sure as we do that, and this is something that we're working hard to do in collaboration with partners, that we really are thinking about all the impacts of wildfire. There's a tendency to focus on like the forest and trees and not on the downwind impacts of fires, particularly on low and moderate income Californians who don't have access to, fancy don't have access to safe spaces. And we saw major progress on that this year. I think there's a lot more work to be done, but what I would say is that we are making progress in the policy space, and every year there seems to be an increased appetite to do more and to think bigger. And I find that it makes me optimistic about the future for California.
And you provide a great segue, I think, into Ami's work with the populations you work with, Ami. Same question to you.
Yeah, thank you, Lisa. APEN, as a grassroots environmental justice organization, is directly sort of organizing and working with immigrant and refugee communities. We're really focused on Asian American communities in the Bay Area, and we're absolutely seeing the impact of the intensifying climate crisis, including impacts from wildfire smoke, alongside a multitude of other burdens that are worsening. As we see California push to extremes, we hear scientists say we've lost complete control, that there isn't really a normal anymore. And that when you add all of these multiple impacts, in addition to wildfire smoke, but also power outages and extreme heat, the impact is cumulative. But something I want to uplift for environmental justice communities in particular is that our communities have been plagued with the burden of our polluting industries for generations. And so there's really nothing new about cumulative health burdens. The climate crisis for us is pervasive, meaning that it's felt daily, not just during sort of times of extreme crisis and these longer periods of wildfire smoke. And so we're really thinking about protections for unhoused communities, for folks that have existing chronic health impacts, children with asthma, as well as the elderly, which are all sort of communities that are part of the environmental justice organizing we do. And so we need special protections because our folks are being hit first and worst. They live in older housing. They don't have access to relief. And so we're very much thinking about how to respond in holistic ways.
Great. And Marshall, we'll end with you on this question.
Great, thanks, Lisa, and thanks to Woods and CIGH for hosting this great event. Yeah, just building on what the other panelists said, one thing we focused on in our work is really trying to quantitatively understand how quickly exposures to wildfires are changing, both in outdoor environments, so ambient environments, and also in indoor environments where people spend most of their time, particularly during pandemics. And I think I mean, folks who work on wildfires and maybe folks who have lived in California have some sense of this, but it's really remarkable how quickly this has changed. So a decade ago, wildfires accounted for maybe 10 to 20% of key air pollutants in the state. So think PM 2.5. In the last 2 or 3 years, that number is more like 50% in part of the state, right? So the contribution of wildfire to key pollutants has doubled or tripled just in the span of 10 years, which is just an insane growth in this type of exposure. So that's outdoor exposures, but again, people spend a lot of their time indoors. And so we really need to think about what those indoor environments look like and how they are different across different populations. So some people live in well-sealed houses and can afford fancy indoor filtration. Many others cannot. And those differences for the exact same outdoor exposure, which again is growing really quickly, might lead to very large differences in realized indoor exposures with important disparity implications. So that's something we're actively working on right now, both using existing sort of secondary data, people who've put sensors in their homes, and then trying to partner with Mary's team and other teams to do more monitoring inside homes. But I think this is a key part of the science that honestly is still not fully well developed, but something we're working on.
Great. And Marshall, I think that transitions wonderfully to my next question, which is really to Mary, to really deep dive on what some of those health impacts are. That's been a lot of your work thinking about wildfire exposure in terms of children, pregnancy, and firefighters. Can you tell us a little bit about that health data? And you've also been doing some work on wildfires in schools preparedness. Can you talk to us about that work as well?
Sure, happy to. So we're looking at firefighters that are exposed both acutely to smoke and looking at how their immune system is impacted in their health, and also chronic exposure, so retired firefighters. And they would be the extreme case of exposure. And we're looking at how immune dysfunction occurs. And one reason this is important is because, you know, there's also for the general population, times when we are experiencing a brief exposure to the smoke versus a more long-term exposure. Some of our research that's just coming out is we looked at people who were exposed, or who we collected blood baseline and then exposed during last year's August and September 2020 Bay Area fires. And we're seeing changes in biomarkers in just typical people who are typically inside and, you know, not out fighting those fires, but we're still seeing health implications. As far as children, overall, 7.4 million children are impacted by wildfire smoke annually in the US alone. So some of our research is looking at how children are impacted both with and without asthma, from wildfire smoke, even occurring 60 miles away. And we can see changes in their immune system just from that type of exposure. And so one area that we're interested in is providing air purification to children that live in areas that are typically impacted by poor air quality and wildfire smoke. And trying to figure out, you know, given as much as possible, putting the best possible scenario, having filtration at school versus not, and at home versus not, you know, how much can we impact or improve their health? We know that the wildfire smoke, the very, very small particles can cross over into the blood-brain barrier and can cause, you know, more neurocognitive changes. There's been some studies showing it impacts test scores in children, memory, possibly autism, ADHD, things like that. So it's really an area of concern that some of our most vulnerable populations, children, are being exposed to the smoke in addition to poor air quality in general, and are suffering because of that, and will probably have long-term health impacts as adults.
Yeah, and I think what's very sobering about all of this is that this is no longer a one and done. This is a sort of an insult that they're facing every single year, since we're seeing wildfires every year now. Amil, I'll turn it back over to you. You started to talk about this in terms of the pervasiveness of environmental determinants of health, that communities have been struggling with this for a long while, and that it isn't just about the extremes. Can you tell us a little bit about how populations have been made vulnerable, either by poverty or racism, and then other populations, pregnant women, children, and the elderly? What principles are you using in your work on building community resilience centers for climate change to protect the health of these populations?
Yeah, thank you. As I mentioned, we're seeing the way working class communities of color are being hardest hit, again, by a multitude of impacts, from wildfires and wildfire smoke, along with heat waves and power outages and the pandemic. And so amidst these crises, especially the past few years of sort of the convergence of all of these crises, we're seeing, on one hand, the failure of a lot of our traditional emergency response systems that very much collectively, across many examples, are collectively shutting out many people from the support that they need, especially monolingual immigrant and refugee communities like those we organize. We're really pushing for community resilience as the notion of responding sort of beyond just when disasters hit, but really building the systems and supports beforehand to ensure that people have the social supports and the economic supports beforehand, and that we're really investing in that fabric of the community so that people are more resourced every day, alongside being better equipped to respond in those sort of disaster points. Part of that is social services, but it's also sort of a collective vision, and that's kind of where community resilience centers comes in. We're told that when for example, during wildfire smoke, preparedness means going out and buying an air purifier, and spending hundreds of dollars on the technology. Those types of individual approaches are really worsening the divide between people that can afford to protect themselves and those that can't, and that have the means to spend those resources and those who don't. Resilience centers are really investing in community spaces that are already part of the social fabric of communities, and investing in the places people go every day to gather, to organize, and access social services. It's about turning places like schools and libraries and health clinics into resilient spaces that are staffed and equipped to provide food, to provide respite from smoky air, cooling, as well as backup power and other resources the community identifies that are needed. We're seeing this already happen as communities show up, both during the pandemic as well as, again, in everyday sort of community institutions and neighborhood-based places responding, but they often do it with scarce resources. And while we've seen some clean air respite centers show up here and there, we really need to scale up responses like this dramatically.
Thank you, Ami. This work is so important in sort of thinking about community preparedness and investing those resources thoughtfully. Marshall, I'll turn to you now. You've published a lot of really sobering data on the exposure of wildfire smoke for pregnant women, and we're often counseled to stay inside by public health officials, but that doesn't always keep us safe. Can you tell us more about that research and what it means for policymakers?
Sure. Yeah, so we, working with colleagues in the medical school and very rich data on birth outcomes in California, we were able to pair the exposure data that I mentioned, really the ambient exposure data, what's the outdoor PM levels during wildfire smoke events, and measure how they relate to birth outcomes, and looking at specifically at prematurity and the likelihood of prematurity across California. And we find pretty large effects. So an additional day of exposure to high particulate loads from wildfire, so think of a bad air quality day from wildfires, increases the likelihood of preterm birth by 1%. So 1 day of exposure, 1%, right? So think of what happens then when you get a week or a month of this exposure. This can dramatically increase the risk of preterm births. And so we calculate that many thousands of excess preterm births were caused by wildfire exposures over the last decade. These are preterm births that would not have happened were it not for the wildfire smoke exposure. And so that's just, again, looking at ambient smoke exposure. And again, we see this very large effect on this key birth outcome, which we know is costly to society. It's costly to individual families, right? It's something we would really like to avoid. Picking up on what Amy said, though, I think what's really important, again, is this is the ambient exposure, right? But people are really indoors. And so right now, it's actually hard for us to measure exactly what individuals are exposed to. The existing data that we have suggests, again, that infiltration of wildfire smoke into indoor environments can vary massively across households, right? It can vary even for households that look fairly similar. Infiltration can vary by 2 orders of magnitude, right? And so, as Amy said, our policy approach has been sort of strange in light of this. What it's been is to rely on the private provision of protection, right? It's to tell individuals you are responsible for protecting yourself, right? That does not seem to work, right? And so even in households who have put purple air devices in their homes where we can very accurately measure this infiltration, even in those relatively wealthy households, we see massive differences in infiltration. So what's happening to the communities and to the individuals who can't even afford that technology and likely can't afford the filtration that we need, right? So it's strange that that's been our policy approach. For other air pollutants, that has not been our approach, right? The Clean Air Act does not tell people to protect themselves, right? It regulates the emission of these pollutants, right? So this is not historically how we've dealt with pollutants. So why should we be doing this with wildfires? It's unlikely to lead to the sort of outcomes that we desire.
Thanks, Marshall. And I mean, I'll say as a pediatric hospitalist, every September and October, we start to see more and more mothers coming in preterm birth. So I am seeing in the hospitals what you are seeing in the data, and it is very scary. Great. My last question is to turn to Michael. And Michael, we've talked a lot about exposure reduction, thinking about keeping our homes and schools safe and building places where communities can go. Another method of exposure reduction is reducing wildfires themselves by thinking about options like prescribed burns. Can you talk to us more about what programs, investments, or policies can help reduce the chances of these large megafires we're seeing as a result of climate change?
Thanks for the question, Lisa. I think the framing that Marshall just provided is the right one. If this were a smokestack that was causing all of this harm, additional harm to California, we would be out regulating that smokestack, forcing it to install pollution control, even as we try to protect people from the harms. And we're working on research to try to understand the degree to which different management strategies can be applied to forests in California to reduce the impacts, these catastrophic smoke impacts that we've been observing. And mostly what that means is, or one way to think about what that means is in many ways undoing the kind of colonialist, structurally racist policies that were put in place in California when Native Americans were extirpated from the land. And Native Americans played a really important role in terms of providing, lighting fires in landscapes that were low intensity, moderate intensity, and kept fuel loads relatively low. We need to recreate something like that in partnership with tribes in California, but also with the federal landowners and with private landowners to try to reduce fuels. We're building models at Stanford to try to project what emissions, how much we could potentially reduce emissions by creating a more fire resilient landscape. And I think connecting that to these public health outcomes is going to be really important for motivating change within the key land management agencies, which tend to think in terms of, owls and logging as kind of the axis with which they view policy. And we really need to shift, the U.S. Forest Service to thinking about the impacts of its policies on public health in urban neighborhoods in California. And that begins with good models that help them to understand the impacts of different choices about how to manage land and the degree to which to use prescribed fire and cultural burning, which is the term for Native American fire practices, how to reintroduce those practices to the land so that we can avoid big catastrophic fires that occur under conditions where the wind is going to blow the smoke over 40 million people.
Thanks so much, Michael. We've covered a lot of great topics here, really thinking about health, thinking about the communities that are made vulnerable either by physiology or poverty and racism, thinking about some potential solutions. Another round here, if we can go through our panelists and thinking ahead to 2022, what further investments do we need to make better, to better protect the health of California residents from wildfire smoke? And this time, why don't we start with Marshall?
Thanks, Lisa. Yeah, so building on what Michael just said, I think the appetite by state and federal policymakers to engage in a big way on doing something about wildfire emissions at their source, right, and getting good fire onto the land and reducing the likelihood of catastrophic fire and the smoke events that it's caused in recent years. That to me is a really important thing that we need to do everything we can to support and scale up. And I think to frame in the way that Michael just said, this is not just about owls and logs, those are important, but it's about the people who are exposed and the millions and millions of people and the babies that are being born preterm. And you know, I think we should dramatically expand our notion of who are the sensitive and affected populations during these events. This affects all of us, right? It affects some of us more than others, but it really affects all of us, and we should be motivated to stop it. That said, that's a slow ship to turn, right? We got to get a lot of good fire on the land, and that's going to take a while. And so in the meantime, we need to figure out very quickly ways to help our most vulnerable communities and individuals reduce their own exposures. And I think there should be investments and subsidies for people buying indoor filtration or setting up the resiliency centers that Amy mentioned, or just any way we can think of to try to help people reduce their exposures.
Great. I'll seg next to Ami with the same question.
Yeah, I think this is an area that we are deeply invested in, engaged in terms of advocating at the state level to push for further investment. And I think fundamentally our push is to invest in community-led solutions like resiliency centers. And part of that is, I think, gets to the need that I've kind of reinforced, which is that we need holistic solutions. I think we see often a lot of silos in the state policy sort of advocacy landscape, where there's a set of folks really advancing a set of solutions around extreme heat response, and then a set of folks on wildfire management, and then sea level rise, and then smoke and other health impacts. And the reason why we think resilience centers are a really powerful model is because it brings together sort of multiple technologies and responses together, very much grounded in what the community is saying they need, and visioning that out, both again to respond to extreme conditions that we're seeing worsening and lengthening in duration, and also the everyday impacts, the health and economic impacts and supports that folks are needing at the community level. Simultaneously, I think that means really socializing community resilience as a complementary and critical piece to, I think, where we see a lot of policy investment happening, which is more of the sort of bigger physical infrastructure projects or natural sort of resource management, like forest management, which are very, very important, but often then the needs of people and communities and neighborhoods, as folks have been mentioning, kind of get left behind, deprioritized, and underfunded. And there's a lot of things we need to be doing in sort of the communities we organize at a neighborhood scale to ensure people are resourced. And then the last thing I'll say, in addition to resilience centers, which are again these sort of collective responses, investment in community facilities, is what's coming on the horizon for us is also an investment in healthy homes, because in many instances, people don't sort of leave. The place that people feel safest in times of crisis is at home. And so how do we ensure that, in the same way we're investing in resilience centers, which we've seen momentum around? Actually, last year, there was an investment of $100 million towards resilience centers. How do we bolster that and simultaneously invest in upgrading and improving people's housing to have good ventilation, energy efficiency, better insulation, and things to keep them safe at home as well. And so it's very much a complementary strategy, both where people live and the services they access. So more coming there next year in terms of our advocacy.
Thank you. I mean, I really love that holistic thinking in terms of how we really think about all of these problems together. Mary, I'll turn the question over to you. What investments do you think policymakers need to be thinking about?
Yeah, I agree with the focus on weatherization, especially the low-income homes, to help be more resilient from all aspects of climate change, not just wildfires. In addition, obviously, schools. I think it's important that we start being aware systematically of the indoor air quality of classrooms, and then increasing mitigation measures wherever possible with air purification. The Bay Area Air Quality Management District is doing some work in this area, doing a rollout of air purifiers to the underserved populations. And I think, on a broad scale that needs to happen to help mitigate some of these impacts from the wildfire smoke and other aspects of climate change.
All right, Michael, we'll end with you.
Well, my hope is that we scale investments in prevention and mitigation, particularly for low and moderate income Californians, substantially over the next year. We spent, state and federal firefighting suppression cost something like $5 billion in 2020. And we spend billions fighting these fires. And we need to be spending and prepared to spend billions protecting Californians, especially low-income working Californians, the unhoused, from the impacts of these crises. We need to be willing to spend at the same level. And we moved pretty constructively in that direction this year. And my goal for the coming year, and my hope, is that we will continue to deepen our investment in ways to protect people from the impacts of these crises, and also in investing in long-term strategies rather than emergency response measures, because this is a long-term problem. Climate change, I wish I could, we were all going to go to the Conference of the Parties in Glasgow and see that, or read in the paper that emissions are falling and we're well on track to, cutting emissions to zero, not net zero, but zero. And that the climate change problem could be something we, taught our kids about, that we'd solved. But this is going to get worse, not better, in the medium term. And we need to plan and prepare and invest for that. And I think California made big steps this year, but we have a lot more to do.
Great. I'm going to turn now to some of our audience questions. So we have a question here. And I'll ask this of all of our panelists, what research areas or gaps around understanding wildfire-related health impacts and creating solutions in under-resourced communities can avail the future funding opportunities? Why don't we start with Marshall?
Hey, thanks. Dangerous question to ask researchers, because they're always going to say, well, we need more research. We have a long list of things. But I do have a long list. So one is on this infiltration question, right? We spend 80 to 90% of our time indoors, most of it in our homes. And we're only really starting to understand how wildfire infiltrates into our homes and how we can stop it from doing so. What are the effective ways to limit our own exposure when we're inside, and who's being exposed right now? So again, we have some initial work on this that suggests just massive differences in infiltration across otherwise very similar households. Even households with the same income that live in the same neighborhood, you can see 10-fold, 20-fold differences in infiltration, right? So there's that suggests a very large behavioral component that we don't really understand. And without understanding it, it's hard to know how to intervene, right? So I think some basic research on here, and in terms of putting monitors, not just in wealthy people's homes, but in many different people's homes, and understanding the behaviors of the housing characteristics, the information sets that determine this behavior. This for me is very important for understanding both what the health impacts are and then how to intervene effectively.
Why don't we turn it to Mary next?
Yeah, so one thing that I think is a huge gap is that we're not able to do our research in real time. So if there's a way that we can have an idea of health impacts, who's coming into the emergency room, who's coming into the hospital, as a community is experiencing the smoke itself, I think that would be very helpful to be able to determine, are we missing certain populations? Are we underestimating the impact of the smoke? And what do we need to do to try to prevent some of the exposure and more warning to people when the exposure might occur.
And I'll build off some of the work that Mary and I do. We don't have a lot of data of what indoor air quality is looking like at public schools kind of throughout the state. And so it seems like that's another important point of information, particularly during the wildfire season, to know what kids are breathing within the classrooms as well. Michael, question to you.
I would say, I really want to see, one thing that we're working hard on is developing better statistical methods to understand the effectiveness of different interventions that might reduce smoke emissions from wildfire. I think I would absolutely agree with everything that's been said about the need to understand indoor exposures. And the Clean Air Act kind of created a blind spot because it's been so focused on outdoor ambient air, but we really do need to understand what's going on inside people's homes and in schools. But we also need much better data that's not just anecdotal, a much better quantitative understanding of what we could actually achieve in terms of reducing emissions. We're not going to get rid of fire in California. Fire is natural. It's as natural as rain in our forests. But we need to think about if we can manage its impacts to reduce the outcomes that we're seeing, the really negative outcomes. We'll be working hard on that.
And Ami, we'll end with you. Same question.
Yeah, I think from our perspective, there's two sort of gaps that we're looking to address in our advocacy. One of them is the state of California doesn't quite yet have a comprehensive integrated sort of mapping platform to identify hotspots of climate vulnerability. We have CalEnviroscreen, which is a very powerful tool and approach that we point to as part of targeting communities that are disproportionately impacted by pollution and poverty. But when it comes to climate change vulnerability and thinking about wildfires and extreme heat and sort of the broader set of what we're experiencing and what's to come, there's not a comprehensive framework, although the Office of Planning Research is actually undertaking a project to develop a vulnerable communities mapping platform. We're very excited about that because it's based on many recommendations we needed, but partly a complementary platform like that can really help us target hotspots of vulnerability. And we know that wildfire smoke is one of those impacts that's very, very hard to sort of depict in mapping as part of broader vulnerability frameworks. But ideally, everyone can get resources to protect our communities across the state. And we do need a targeting and prioritization framework because we know particular communities are being impacted first and worst. Really thinking about environmental justice communities, again, that already have a broad set of chronic health conditions we're experiencing. And so anyway, I think that type of mapping platform could really help us target our policies and solutions at the state level in an equitable way. And then complementary just to that question, I think one gap, maybe not on the data side, but I think there's still a lot of knowledge gaps in the policy sort of landscape as it relates to what community resilience looks like and means, that we have clear solutions on that. But I think most of the discussion is very much sort of the broader infrastructure investments.
Great. Our next question, and I think this might be Michael specific. The U.S. Forest Service has stated that for every $1 we could be spending on preventing wildfire ignitions, we're spending $35 in suppression wildfire damages. What is needed to get more dollars going into preventing wildfire ignitions and therefore radically reducing health effects from wildfire smoke?
Well, it's, I think Marshall might have said something about a sort of a super tanker image, and the Forest Service is definitely a super tanker. They, the agency has spent the better part of 100 years focused on timber harvest and fire suppression. And, getting that perspective shifted takes time. It also takes a real shift in budget priorities. And, the California delegation in Congress has really tried to move and still trying to move legislation that would do that. There's a big piece of the reconciliation package that concerns the Forest Service and the need to do better fuels management. But I think, the main thing I would say is just we really need a shift in perspective. The Forest Service typically harvests about $250 million worth of timber from its lands in any given year. Wildfire-related smoke, sickness, and death in 2018 cost California an estimated $32 billion. But the Forest Service is still focused on logging. And that's just not right. It may be a land of many uses, but we need to focus on the impacts that mismanagement is having on the neighbors, right? On folks in California. Talk to anyone from Reno or Carson City, anyone in Nevada, and they'll tell you about the impacts of forest management in California on their lives. So, it's a budget and policy shift that takes time, and it takes will, and it takes political leadership from the top and clear direction. And I'm hopeful that we're going to get more of that in the coming year.
I want to open it up in case any of the other panelists want to add anything to what Michael said. All right, the next question is, how do you view the financial liabilities related to smoke-related health consequences? As an example, we've recently seen utilities like PG&E being charged with crimes related to smoke-related health consequences of their ignitions. I think this might also be Michael, but I'll open it up to all the panelists, whoever wants to jump in first.
Go for it, Michael.
All right. Well, so PG&E was the Sonoma County DA has brought a charge against PG&E related to the Kincaid fire that seeks to recover costs associated with the health harms from smoke that Sonoma County bore after PG&E's transmission line set afire. I think that's a really important direction to move in. We need to create accountability for landowners for how, if and when they cause ignitions. But more than that, also, I would argue we need to be thinking about how to create accountability for landowners for how they manage their land, right? If today, you have no real liability for leaving your land in a way such that it's a tinderbox, right? And so that when a fire does reach it, it explodes and spews smoke across the landscape. So why would you do differently? It gets to kind of basic notions of nuisance and, what is an appropriate way, what is an appropriate set of activities on your land that don't interfere with the enjoyment and health of others that are your neighbors. And I do think we need to be thinking hard about the impacts of smoke and looking at ways to maybe create some liability for big landowners so that they take appropriate action, reasonable actions to reduce the risks for others. I don't know if the PG&E case is the right way to do that. I think the biggest actor, of course, is the Forest Service in this whole game, and they have sovereign immunity because it's the federal government. But I think these kinds of cases are going to start to shift thinking, and I think that's a positive. We really need to be pushing people to invest to reduce risk.
I just want to add I think this is a great question, and wanted to offer that in the sort of from the community organizing perspective. I think environmental justice advocates are very much on the forefront of creating campaigns just to continue to bring to light and really expose and mobilize around holding utilities, particularly PG&E, accountable for the harm across California communities as it relates to wildfires, both the power outages, wildfire smoke, and the broader sort of, and most importantly, the devastation directly. I think I want to point folks just in relation to this question to a campaign called Reclaim Our Power Utility Justice Campaign that I think just speaks to the ways that that pressure and community organizing is actually really important as part of shaping the broader conversation of who pays and who are we holding accountable. I'm very concerned that it sort of a lot of these costs that the utilities are sort of experiencing are just passed off to ratepayers. And so we pay more for our bills as a result of the utilities negligence is causing. And so that's harmful, particularly to working class communities. And I think just speaks to a broader landscape in California of sort of it becoming untenable for us to afford our energy amidst this growing crisis. But more information on the campaign and some of the demands on their website.
Thank you so much, Ami and Michael, for those great answers. We're going to switch gears a little bit and talk a little bit about public health messaging. We've kind of seen things all across the board when it comes to masking. 2 years ago, different counties were providing different guidance on the use of N95s, for example. And so in thinking about ensuring, how do we ensure that the data, things like AQI and mitigation instructions for masking for vulnerable populations, staying indoors, is communicated effectively and equitably? How do we provide statewide standards for smoke-related messages, along with standardizing modes of alert communications?
Mary, I would love to hear what.
Yeah.
Sorry, I was going to see if Mary wanted to talk about. I know you guys have been working on masks, and I know the science is sort of evolving here. Mary, do you guys have updated studies on that, or I'd just be interested to learn myself.
We don't have our own research updated with, if you're talking about like N95 masks versus surgical masks versus cloth masks, but there have been more studies coming out, looking at both in terms of COVID and in terms of wildfire smoke, how much protection is really afforded. But I think there's still a lot of work to be done to determine, especially for the vulnerable populations, who should be wearing what, and how can you standardize the message, but not, interfere with someone who has some type of, for example, respiratory problem, and shouldn't be wearing a mask, or needs to have one with less filtration, making it easier to breathe. Yeah, so I don't know, Lisa, maybe you have more to say about that, but I think it's an area that definitely needs a focus and develop recommendations for the different populations.
One of the things I've seen that's troubling is this counseling of N95s during periods of excessive heat, or people that are doing something with high exertion, like outdoor workers, when we just need laws in place where people shouldn't be working under those conditions, because the point of an N95 is not to protect you from any wildfire smoke. You're really just supposed to be using it if you have to go outside for some reason, but you shouldn't be wearing it and working in a field, for example. That's not safe, and that's not protective for health. So I think we need to really be rethinking about some of these intervention programs of handing N95 masks out, and instead focus more on how do we protect workers outside that shouldn't be outside to begin with.
Lisa, if I can add to that too, that makes a lot of sense. I do worry. So we've done some research on whether information is a constraint to people just changing their own behavior. And it looks like, at least within California, but also outside California, people seem pretty well informed about what their actual exposure is. I mean, people notice when air quality gets bad outside them, they often change their behavior, at least as best we can measure it. But what we see is those changes in behavior do not necessarily limit their exposure. So I actually am a little bit worried about an information-only approach, or the belief that just giving people better information about their exposures is going to improve outcomes. I don't think that it will. I think the more fundamental constraints is that people cannot limit their exposures, even if they are knowledgeable about what those exposures are. So I would while information is important, it's necessary, but it's certainly not sufficient. And I would say we focus on the harder problem of giving people the technologies, the spaces, the approaches that actually limit their exposures.
Yeah, I just wanted, I think, just echo that piece, that information alone without sort of a through line to access to the protections, the supports, even something as simple as mass distribution is is really important to link, because that knowledge is powerless without sort of the resources to do something about it and protect your community. So I think the role of community-based organizations in sort of disseminating not only information about safety and prevention, but then offering the resources they have. It can go as far as like the structural interventions we want to see through policy, like building sort of retrofits, but in addition, mass, as well as, this innovative, like how to make your own sort of like air purifiers at home. Like there's ways that, especially working class communities, are really resourceful with the material resources they do have. So wanted to uplift that. And then the other pieces, in thinking about reaching non-English speaking communities that are monolingual, like I think a lot of our sort of communication channels right now are still really like lacking in terms of reaching the cultural diversity and language diversity, especially in a state like California. And so, and it's not just about like using a multitude of languages through these alerts, but reaching them in the channels that they're using, whether that's WhatsApp or WeChat or the sort of culturally specific technology platforms that people are using. We had a whole campaign early in APEN's history around a multilingual warning system for the Chevron refinery when there were explosions. And that system was only in English for a long time until we organized to get it to be multilingual. So that was a phone system many decades ago, but now it's more through apps and social media that people get their information from. So it's only through working with community orgs that folks can really know what those specific strategies are.
I'll just say one more thing about masks, and that is that there's also the risk of it giving a false sense of security. So if you give someone a mask and they think that they're more likely to go outside or be exposed and think that they're protected, well, they potentially might be somewhat more protective, but there's other things like the gases that the mask isn't going to filter. So I think the comment about looking beyond just education for masks or giving out masks is quite good.
This is a quicker question, I think. Are there any resources as examples for smoke mapping, say at the state level between wildfires and prescribed fires? It seems it could be useful to have a mapping tool to determine which communities would be impacted.
We recently worked with the California NPR newsroom to put together some public resources on this. And so they are a way of looking at not just California, but across the country using our ambient, again, this is outdoor smoke exposures, but using that information to map at a county level or at a zip code level what these exposures look like and how they're changing. We hope to improve that tool as the sort of science gets better going forward, but that's happy to send out that link if that's useful to folks.
A question for Mary. We know that wildfire smoke is more toxic than the typical air pollution we breathe. Should some of our guidance be changing as we're reading those AQIs during wildfire season to lower our thresholds, as we're thinking that wildfire pollution and regular air pollution aren't really apples to apples, and thinking about our AQI cutoffs?
Yeah, I think that's a great point. And I do think that the AQI scale should be adjusted for the what we're learning now as far as toxicity. I mean, there's even studies showing that if you look at the EPA criteria, pollutants outside of wildfire, just regular air pollution, even if you're under that threshold, we can see health impacts such as high blood pressure associations. So I think reevaluating those criteria would be super helpful. And also the level of the AQI doesn't go high enough for wildfire exposure. It caps off at a level of which, maybe many of us recently were exposed to, at least in last year's fires. So I think that's a great point.
Yeah, I believe Lake Tahoe saw in the thousands, if I'm not mistaken, during some of the worst of their the fires that were burning there. Great.
Lisa, can I add one thing there, just to echo Mary's point? We get focused on these AQI measures, and it's sort of this threshold thing. If you're above 100 or 150, you need to take these behaviors, stay indoors, whatever. If you're below, you're okay. all the new research on this suggests that is not true, right? Any level of exposure is bad. And so you should try to reduce your exposure at any level, right? Way, way, way below 100 or 150 or the standard levels at which we tell people to start doing things, right? That shows up in all the health outcomes that we've looked at. This stuff is way worse than the thresholds would have you believe. So I believe absolutely even our information on when to do things is pretty imperfect.
We're almost at time here. We've covered a lot of heavy information here that can feel depressing at times. So I'm going to ask each of you one uplifting thing in the work to leave our participants with in the work that you do on wildfires, health, and resilience.
I'll go. You know, I was really excited this year. I worked with sort of very uncommon coalition of tribes and the Cattlemen's Association and, you know, sort of, and prescribed burn associations to pass a series of, to develop and get enacted a series of policies that will make it easier to do the right thing in forests and reduce risks for the people that are doing the work. And it was passed with bipartisan supermajorities in both houses, and Governor Newsom signed the laws. And I think it's really exciting to see that work moving forward, and that these issues are really bipartisan, right? We all live in California. We all know that this is a crisis, and folks are ready to step up and take action.
What Michael said for me, that feels like the bright point. People are starting to take this seriously, and just in the last few months, as Michael said, we've seen really impressive steps in that direction on the legislative front in California. So that for sure gives me hope.
And I would have to say, sorry, the focus on the vulnerable populations and our work with the schools, I think is pretty uplifting, because people are becoming more and more aware of the importance of the indoor air quality, especially in children. So I think it's a great research topic, and obviously a goal for all of us to better the health of our children.
And I'll just end, I think because I work at a grassroots community organization, I'm always like filled with hope, despite sort of historic disinvestment and, you know, continuing to see systemic failures. Our communities are incredibly resilient. They've had to be, and they're consistently innovating local models and solutions for, and organizing and building power for change. And so that gives me a lot of hope. And especially during times of crisis, we see communities come together to support each other. And in some ways that is like often the moments that we see the best in humanity. And so I'm hopeful that through the continued sort of grassroots organizing, we'll build that social cohesion and support our communities in response to all they're experiencing. And I think that if folks are, you know, the audience members are here, are interested in like really learning about that community work, at least in the Bay Area, there's lots of events and innovative sort of workshops and resource distribution, mutual aid networks that we're connected to that are, I think, an opening to support, whether that be through donations or volunteering your time.
I mean, I think those are great closing thoughts for us, that there is hope and there's a path forward, and we have a lot of great people working on these very big problems together. Thank you so much to all of our panelists for joining, for all of our participants for joining us in the conversation.